It is Tuesday, July 28th. Welcome to the COVID-19 Task Force update. As we enter the midpoint of summer, there is so much to report on. Good news, bad news, and all kinds of news. We have some, we'll start off with some good news, and joining us, as she often does on this program, is the Executive Director of the Kahnawake Memorial Hospital Centre, Lisa Westaway. Lisa?
Good afternoon. So I'm here to provide you with some updates and some changes that are happening at Kahnawake Memorial Hospital Centre. So firstly, for the updates for the testing site, just to give you some information, over the last couple of weeks we've tested close to 100 people, and we do not have any new positive cases in Kahnawake. So that's important information to provide to you, and we would like to continue to encourage you to call KMHC for testing should you be experiencing any COVID-related symptoms, such as difficulty breathing, a new sudden onset of a cough, lack of taste or smell. So you please call KMHC should you have any symptoms, and of course we will do a little evaluation with you over the phone and investigate whether you should be tested or not. So we continue to test. Our testing site will be open until September, and it's important that you call should you have symptoms. Another bit of updates that we wanted to provide is regarding masking. So we've done the communications team has done a wonderful masking campaign over the last few weeks. Again, masking is only going to be helpful if we're doing it at the same time as proper hygiene measures, as well as maintaining our distance from people who are not living in our household. So we have to keep those three elements always in mind with everything we do in order to prevent increase in transmission of the virus over the next coming days, weeks, and months. As we've seen in Quebec, and Lloyd will talk about it a little bit afterwards, but as we see, rates continue to increase around us. So although we are not experiencing any new cases presently in Kahnawake, or none that we know of the people who have been tested, we still are at risk of having new cases in the community, and these can multiply very quickly. So it's very important that we maintain the measures that we have in place. A few elements that I've been asked to repeat is about masking, and to remind people that they shouldn't be touching their masks. So it's important that you have a mask that fits properly, that is not moving all around, and that you don't consistently have to lift up or move around. If you are going indoors and outdoors, or in and out of stores, it's always best to leave the mask on, because again, the more you touch your mask and the more you touch your face, the more risk of transmission of virus that you have, even to your own self. And so it's important that if you're going to remove the mask, that you remove it from the elastics behind the ears. And when you're going in and out of places, or if you need to speak with someone, it's not helpful for you to put the mask on your chin. That actually is detrimental to you and could cause transmission of the virus to your own self. So please refrain from putting the mask on your chin. And also we wanted to talk a little bit again about disposable masks versus washable masks. And so some people have been asking questions about what the difference is between the two. So the reason why we're promoting washable masks is for several reasons. Number one is environmental. So we want to avoid throwing masks away constantly. Also for economic reasons. So it's cheaper to have a washable mask that you can wash and reuse on a daily basis, even though each individual disposable mask might be cheaper than a washable mask in the long run, and we're talking, possibly a year where we're going to be wearing masks in public places. It would be a lot cheaper to have a washable mask. Also, and finally, the most important, considering that we don't know what's happening in the months to come, and there could be a very big need to be using procedure masks in healthcare settings, we want to save the use of these procedure masks for for our hospital workers. So it's really important for you to use a washable mask, and there are many local vendors presently online and in local shop Kahnawake boutiques where you can purchase a mask. So I wanted to also give some updates regarding KMHC. The first, I spoke about it several weeks ago, is that we have started allowing residents to eat in the dining room. So of course this is done in a safe manner. Every change that we make is done in phases, and it's done according to all the principles that we speak about on Facebook Live, meaning hand hygiene, distance, masking when we can't be more than 2 meters from someone. And so all of those measures are implemented in the procedures that we put in place in the hospital, and that's the same for the dining room. So all of those residents who want to eat in the dining room are able to do so. That started on Monday, and some people are still choosing to eat in their rooms, and therefore residents do have a choice, and we're just in the process of phasing in this dining room eating back to the way it was before. Again, this is positive. It increases socialization. It allows residents to see and speak with each other. And residents continue to go outside on a regular basis if this is what they want to do, and we have some of our workers who are bringing residents down to the inner courtyard. So residents are getting fresh air. I know that some people still have the misconception that residents are not getting outside, so this is not the case and has not been the case for quite a while. So I just wanted to reiterate that our residents are going outside. Next point, on Sunday we have again our drop-off from 10 to 1 for residents. We are adding an element to this drop-off, and this has been a while that residents and family members have been asking to either order takeout or to bring food in, and so we're going to combine this new measure with the drop-off on Sunday. So we do not want any deliveries directly to the hospital, but we're opening it up for family members to bring takeout in to the drop-off, or to bring homemade goods into the drop-off on Sunday from 10 to 1, and our workers will ensure to disinfect and make sure that everything is safe when they bring it to your loved ones. And so we ask that you coordinate with your family members, because some residents have many children, and of course we have space issues in the fridge. So we ask that you coordinate drop-off items, but you can, this will be the first time that we're allowing takeout or homemade goods to be delivered to residents. So just keep in mind that all of the items be well identified so that we ensure to get them to your loved ones. So lastly, I would like to talk about visitation. There are significant changes happening to visitation. I want to go back to early June. We had a Zoom meeting with families. We also consulted with all the residents at KMHC, and we asked where people are at, what they felt that they needed, how we could move forward while respecting the need for better connection between residents and their family members. And at that time, we implemented a 3-phased approach in moving towards visitation in the residents' rooms. Of course, respecting all safety measures again. So we know that this is a scary change that we're going to be putting in place. So our first phase, as you know, was at a very large distance in a very sterile room on the main floor of KMHC. Since then, phase 2 was at a much closer distance with PPE, hygiene, holding hands. This phase 2, the second phase, went very well and had a very positive response from family members. And since then, the room is less sterile. It's more of a homey environment with plants and also with pictures on the walls. But we know that this phase 2 had its own own difficulties, and the difficulties were that visits were only scheduled once every 2 weeks for each resident, and considering the amount of people asking to visit each resident, we were not able to accommodate everybody's requests, and this was causing frustration. Our actual phase 3 had originally been set to be put in place on July 20th. That was a week ago, and we had postponed, and in fact you're going to be receiving a letter from me that says that we postponed that phase because of the outbreaks that happened around us in the Montérégie sector. And considering what had happened that week before around us, we did not feel that it was safe to move to our phase 3 visitation, which is in the patient or the resident's room. Since that time, 2 weeks have gone by, and we have evaluated the safety surrounding us and surrounding our Kahnawake in particular in order to make a decision to move to this next phase. And so what we have done was evaluate the number of people who had come in for testing or for screening as a result of the outbreaks in the bars and restaurants and parties. And there were a total of 84 people who had been tested or screened as a result of those outbreaks. And when we received all of the results of those tests very recently, seeing that they were all negative, we were able to make the decision just today, in fact, to move to the phase 3 of visitation. So that's what I'm presenting to you today. Phase 3 visitation will be very similar actually to phase 2 in terms of safety measures. So wearing the PPE, having someone observe you when you put the equipment on, having staff close by should you require assistance, being accompanied to the resident's room. You'll be able to hold hands. So again, there's no change in the type of contact that you'll have with your loved one. However, you will be in a different setting. You'll be in their room. So we're hoping that that will be more of a comfort to you and your family member. And the door will be left open to the resident's room to ensure that staff are available to assist you should you require assistance. We're really counting on you, on family members, to respect all of your own safety measures that we're promoting on a day-to-day basis in your day-to-day lives. Prior to coming to visit. That's especially important. Again, we'll be doing health checks with you before you come to your appointment. So all of the safety measures we've already implemented and that you're used to will continue in this next phase. The only difference is that it will be in the patient's room. Now, it's important to note that there are some residents and some family members who do not wish to have visitors in their room at this time. So we've spoken to residents, and there are some that will refuse. In those instances, visits will still occur as they are in phase 2 on the main floor of the KMHC of the hospital. And so it's really important for us to respect residents' wishes. And as we know, we all have different levels of fear or anxiety with respect to our own risk or our loved one's risk. And so it's important that we respect those wishes as they're expressed. And so you may have frustration if we let you know that your loved one has asked that the visit remain on the main floor of the hospital, but we ask that you be understanding regarding that. So many of you are probably asking the question, what do I do with my visits that are already scheduled? So that's a good question. This next week will probably be a little bit confusing as we transition from appointments that are already scheduled to visits on inpatient. So you will all be receiving a telephone call within the next couple of days. Your first visit with your loved one in their room will be scheduled during that phone call. However, any subsequent visits, and we'll be repeating this again on Facebook Live, and we'll have the information on our website, but subsequent visits will be scheduled by you, by the family member or by any person who wants to come and visit. We will be giving you a specific phone call, and you will call us to book your appointment. So your first visit will be scheduled by us, because we need to call you to explain the rules and the procedures, so that we can all ensure to do this safely and make sure that that we move towards this third phase in a good, positive way. So I just want to make it very clear that we would not be moving towards this phase if we didn't feel that it was the right time to do so. We know that we've had various people asking questions, wondering when we're going to move to this next phase. We have been very systematic in our approach. We've phased this in the same way that we've done with business reopening, and we feel that on the medical side that we've evaluated properly, and we're ready to move to this phase. But again, these are personal decisions, and if anybody is uncomfortable with being in their loved one's room, then we can continue the visits as they are now. So again, I invite you to visit the KMHC website. We will have information there starting tomorrow and again next week, and we'll continue to promote these visits, but you will receive a phone call from the hospital. So thank you very much.
Thank you very much, Lisa. And it's important to note, we had someone send in a question or a comment during this broadcast about why we're not wearing face masks during the update. And of course, this is a very controlled environment. And we've been very careful. As a matter of fact, people have joked about the fact that we do this so often. And one of the main ways of combating COVID-19 has been wash your hands. And so that continues to be the main message. Just wanted to make my own comment about the masks, because I've been, I guess the directive happened over the weekend, and everywhere I have gone, every store I have gone into, and I've gone to about 3 or 4 of the little corner stores, and everybody is complying, and that includes even the youngsters who are dropping into the store. So that's good work. And again, I'd like to congratulate my colleagues while I was on vacation. The great campaign of people wearing masks and just being seen everywhere. It's great work, and it shows that we are really on the same page, because we continue to be in a situation that none of us thought we didn't think we'd still be here in July after, this thing started in March, but here we are. And so far, we have weathered the storm. Joining us now is the Commissioner of Public Safety, Lloyd Phillips. Lloyd?
Thank you, Joe. Thank you, Lisa, for that update. Yeah, certainly that was a question that we talked about, I think a couple of episodes ago regarding masks, and people had asked that why here on Facebook Live we're not wearing masks. As Joe mentioned, this is a controlled environment, and the area that we're in now is not a public area. People have to do health checks before they enter the area, and obviously we make sure that we're always maintaining our 6 feet distance. And so if you're in a non-public area and you're able to meet those criteria, and then such as organizations and various businesses and such that are not open to the public, you could go without a mask. But the key words are public and indoor. So I know it's been done very well, as Joe mentioned. There's been great compliance, across the board. That there's also been. Personally, I've been looking visually and watching and seeing what's happening out there in terms of masks, and again, compliance has been great. Our inspectors are out there just observing and seeing what's happening. No, there's been no need for inspectors and/or peacekeepers to intervene at any time since we made masks mandatory. So obviously that is a positive thing. There was also a question about, is masks going to remain mandatory in the community? And right now, the answer is yes. For the foreseeable future, the mask will remain mandatory. We talked about it before regarding Basically, we're talking about a three-pillared approach to combating the virus. One, obviously, is hand hygiene, distancing, and now masks when you're indoor public area are the three main pillars. It's basically almost a prescription, for COVID virus at this point in time. So those are things that we're going to maintain. We're going to keep repeating over and over again because it is crucial to keep the number. Right now, as Lisa mentioned, there are no active cases in our community. And that's how we want to keep it. We'll do everything we possibly can to keep it that way moving forward, because we do see numbers gradually increasing in the province of Quebec, gradually increasing in across Canada, and obviously if you look down south and into the U.S., the numbers are basically skyrocketing out of control. So we want to take whatever measures we can here and as Kahnawake to ensure we're as safe as we possibly can be. There will be a time we will revisit that directive and to seeing if we feel safe and we feel confident that that's something that we could pull back on. We certainly will always look at that and revisit that directive, as we do with all directives that are in place. We do a review to see, is it still relevant? Does it need to be modified? Does it need to be strengthened or totally removed? So those things are going to be obviously ongoing over the next while. There will be a task force meeting tomorrow. We didn't have one last week. We spent a lot of time doing a little bit of planning for the future. I mentioned this on last Facebook Live as well, that we're looking into the future a little bit, to seeing, playing a little bit of, I guess, the what if game, which unfortunately at this point in time we have to. What if there is a second wave? And I'm sure anybody who's been watching the news have heard that being talked about on all the media on what a second wave could look like, how bad a second wave could be. Some people are predicting it could be worse than the first. Some are predicting it ain't going to be that bad. So we have to look at all these possible scenarios and prepare ourselves. I guess maybe for the best case scenario, but also for the worst case scenario. And what we're looking at doing is assessing what has been done in our community since March, throughout April, May, and June, and where we are today, and how things went from a start and to where we are now, and what happened, and how things were put into place. And as we know now, measures are gradually being reduced. Things are starting to look back into what we're calling the new normal. But again, what if things start going in the wrong direction in terms of cases, in terms of positives, in terms of people getting sick and so on? How do we start reinstituting various measures to limit the spread of the virus? And what I'm doing is breaking it down into steps. At this point, we're looking at 3 different steps, leading from basically minor tweaks to what's currently happening to the end result, which would probably look something similar to a full lockdown again, like we've seen throughout most of the month of April. I want to relay that to the community as well, because I think it's only fair for the community to know that we are planning for the future. We are planning for a worst case scenario. We are making these plans to address whatever comes our way. There was no playbook, when we got involved with the COVID-19 virus back in March. Now we have some idea what to do. We have more understanding of the virus itself, and we have a better plan moving forward. And these plans that we're developing, I'll be more than happy to put them on a shelf and never have to use them. But if we have to use them, I'm glad that we will have them to use and have a plan moving forward if time comes where we have to take strong measures again to protect our community. And along the same lines, each organization who's involved in the task force has been asked to submit a report to the task force, basically looking at 3 things. What went well throughout the pandemic? What were some of your challenges, given some of the directives and some of the issues you may have had dealing with community issues? And what are some of the things that you would do differently if you had to do it again? So all that information is being gathered. It's being brought back to the task force, which the task force itself will be creating a report that would help even I guess maybe the plans we're doing to put much more detail behind them. So if we know what some of the challenges were, if we're knowing what the people on the ground would do differently, we can incorporate that into a more comprehensive plan. So we'll even have a stronger plan moving forward, in the event that we do need that. So a lot of work happening. I know some of this information may be repetitious to the ones who watch us on a regular basis, but I think it's important for people to understand where we're at in terms in a task force, and the fact that even though we only do Facebook Live twice a week now, there's still a lot of things happening behind the scenes. We're still monitoring what's happening, obviously first and foremost in our community, what's happening around Kahnawake and our neighboring communities, throughout the province and internationally for that matter. We're also keep tabs on what's happening in Germany and Belgium and other countries who have seen the first wave come and go, and now they're looking at what's happening, what's happening there now, a few months after the first wave have ended. So we have to keep tabs on these things because obviously we don't live in our own silo, we don't live in a bubble. The world around us impacts on us greatly, and we want to be prepared. And I just want to make sure that the community knows that we're preparing ourselves for the best case and the worst case scenario. And it's not put out there to put fear in anybody, but it's just the reality that we're living. And again, I want to make sure our community is safe as it possibly can be. With that, I'll turn it back over to Joe, and I'll see you again soon. Kahnawake.
And thanks so much, Lloyd. Just a note before we leave. Lisa was mentioning that phase 3, there will be the visits at the hospital in the patients' rooms. Remember, all visits have to be done through appointment. You can't just come in and expect to go in because there are protocols to be followed. She mentioned the protective clothing, clothing that people have to wear when they come into the hospital. They're going to be given that, and when they leave, they'll have to give it back. There are certain protocols, so you can't just walk in. You have to take care and make your appointments, and it'll be, it's a great improvement from where we were back in March and April. That is for sure. With that, I'd like to say thanks to everybody who joined us today, and we shall be back on Thursday with another update for you from the COVID-19 task force. So on behalf of everybody here, Kahnawake.